All right, for my teaching plan, I did, well, my care plan, my evidence-based practice care plan, I chose to do it on Boyd Dubose, and he is a 58-year-old male, 240 pounds, no known drug allergies. He was admitted Wednesday morning for a total right hip replacement. So I chose to do my teaching plan along with his hip replacement surgery. And so I started with, in the assessment, I did my target audience. He is 58, so I did my target audience between the ages of 50 to 75 because that is the age group at which are at higher risk for falls and specifically for like hip replacements and stuff due to they're not having the bone density of younger adults. So the growth and development stage for these adults are generativity versus stagnation and integrity versus despair. So sometimes these adults struggle when they have to have these surgeries, thinking it may be end of life for them because they, at this point in their life, they need to feel like they have served a purpose and that they have become who they wanted to be, and they've left an important message behind. And for people who have not yet met that goal, may feel threatened by having this hip replacement done. But within my teaching plan, I use this opportunity to teach about the interventions for falls and how to prevent them, what to do if you think you're about to fall, or using your assistive devices that may be assigned to you to help prevent a fall. So for my planning, I found a reference in our fundamentals book. No. For planning, I found a reference in a journal, which I found on EBSCOhost, the Pharmacy Practice Journal. It was titled Falls in the Elderly, Assessment of Prevalence and Risk Factors, and it said that research shows that nearly 28 to 35% of people aged 65 years and above fall each year, and this percentage increases to between 32 to 42% for those over 70 years of age. So in the teaching plan, I went on with my interventions and taught about the risk factors. So your risk factors of falling, your women who have osteoporosis, your men who may have unsteady gait, or if they had a stroke or something to make their balance wobbly, then they are at higher risk of falling. Also teaching about just keeping the walkways cleared, keeping like clutter free, keeping a clear path to the bathroom, keeping a night light at night so you can see where you're going if you need to get up to prevent falls, and then also the importance of using assistive devices that may be assigned to them by assistive devices that may be assigned to them by physical therapy, occupational therapy. So I said my outcomes would be the audience will be able to identify common risk factors associated with falls. The audience will demonstrate the proper use of assistive devices assigned to them, and the audience will identify fall prevention strategies and demonstrate. So that is my teaching plan, and I have included the references on the bottom.